Let me start by asking you something very simple, but very important. When you wake up in the morning and swing your legs out of bed, how do they feel? Do they feel ready? Or do they feel heavy, stiff, almost reluctant to move? For a lot of people over 60, that first moment of the day is already a negotiation with their body. You sit for a second, maybe you rub your calves, maybe you stand up slowly just to make sure your legs are going to cooperate. And by the end of the day, your shoes feel tighter than they did in the morning, your socks leave marks around your ankles, your calves ache, your feet feel thick, swollen, restless. Some nights, the cramps hit just as you finally get comfortable. Other nights, it's that deep, buzzing discomfort that makes it impossible to keep your legs still. Most people chalk all of this up to aging. They say, well, I'm not young anymore, or that's just what happens after 60, or everyone my age feels like this. But here's what I want you to understand right from the start. Aging does not cause heavy legs. Aging does not cause swollen ankles. Aging does not cause nighttime leg cramps. What causes those things is poor circulation, specifically poor circulation back up from your legs to your heart. And that distinction matters because aging is something you can't change. Circulation is something you absolutely can. As a vascular specialist, I've spent years looking inside veins, measuring blood flow, watching how circulation changes over time. And one thing has become very clear to me. Most people don't have a circulation problem because their heart is weak. They have a circulation problem because a critical system in their legs has been shut down. A system your body relies on every single day. A system so important that doctors sometimes refer to it as your second heart. And today I'm going to show you how to wake it up, not gradually, not over months, but immediately. Now, before we talk about what to do, we need to talk about why this is happening, because once you understand the why, the solution makes perfect sense. Let's talk about gravity. Gravity is wonderful when blood is traveling down your body. Your heart pumps oxygen-rich blood out through your arteries all the way down to your toes. Gravity helps that process. It's like rolling a ball downhill. The heart doesn't struggle with that part at all. But once that blood has delivered oxygen and nutrients, it has to come back. And this is the part no one really explains. That blood has to travel from your feet, up through your calves, past your knees, through your thighs, and all the way back to your heart. That's a climb of roughly 5 feet, straight up, against gravity, every second of every day. Your heart cannot do that job alone, so your body evolved a backup system. Inside your leg veins are tiny one-way valves. Their job is simple. Let blood move upward, then close so it doesn't fall back down. Think of them like a series of gates on a mountain trail. Open, step up, close. Open, step up, close. When those valves work properly, blood moves upward smoothly and efficiently. But here's the problem. As we age, those valves don't snap shut like they used to. They get weaker, they get slower, they start to leak. When that happens, blood doesn't just move up, it slips back down. And when blood slips backward, it starts to pool. This is called venous insufficiency, but you don't need the medical term. Just remember this, blood goes down easily. Blood comes back up only if everything works perfectly. And for many people over 60, it doesn't. When blood pools in your legs, it creates pressure. That pressure is what causes the symptoms you feel, the heaviness, the aching, the swelling, the cramping. Those bulging blue veins you might see on your calves or ankles, those aren't cosmetic issues, they're pressure signals. They're your veins telling you we're overloaded. Swelling around the ankles isn't fat, it's fluid that has been forced out of the bloodstream because the pressure inside the veins is too high. And when blood sits still for too long, it becomes sluggish, thick, sticky. That's why doctors take leg heaviness seriously, because stagnant blood can clot. Now, I want to be very clear here. I'm not trying to scare you. I'm trying to explain why your body is sending you these signals. Your legs aren't betraying you. They're asking for help. Here's the part most people never hear. Your body already has the solution built in. It's not medication. It's not surgery. It's not even exercise in the way most people think of exercise. It's a muscle-driven pump located deep in your lower legs. Your calf muscles, especially one called the gastrocnemius, wrap tightly around your deepest veins. When that muscle contracts properly, it squeezes those veins like a piston. That squeeze is powerful enough to force blood upward, even against gravity, even through weakened valves. Medical textbooks call this the musculovenous pump. I call it your second heart, because functionally, that's exactly what it is. Your heart pumps blood out. Your calves pump blood back. When that system is working, your legs feel light, warm, energized. When it's not working, blood pools, and everything you're feeling begins. Now here's the critical part. This pump does not activate just because you're standing. It does not activate just because you walk around the house. It activates only when the calf muscle contracts in a very specific way. And in modern life, that almost never happens. We sit too much. We wear stiff shoes. We walk on flat surfaces. We don't flex our ankles through their full range. So over time, that second heart doesn't break. It goes dormant. It falls asleep. And once it does, gravity starts winning. So the question becomes, how do you wake it up? Not with intensity, not with strain, but with precision. And this is where most people get it wrong. They think, I'll just do calf raises. But traditional calf raises are designed to build muscle size, not restore circulation. They're fast. They rely on momentum. They ignore the valves inside your veins. Blood doesn't move because of momentum. Blood moves because of controlled muscle contraction and proper valve timing. That's why we use a movement called the dynamic rocker. This is not about strength. It's about turning your circulatory system back on. Before we even talk about the movement itself, we need to talk about safety, because if your body doesn't feel safe, it won't cooperate. Find something solid to hold on to. A kitchen counter is perfect. A heavy chair works too, as long as it doesn't move. Place both hands on it. Stand tall, not rigid, not tense, just tall. Imagine a string gently lifting the top of your head. Here's why this matters. When you feel unstable, your nervous system goes into protective mode. Blood vessels tighten, muscles guard. When you feel supported, your nervous system relaxes. Blood vessels open. Circulation improves. We are not testing balance today. We are restoring flow. Now let's start the movement. Slowly lift your heels. As you lift, exhale, count it out. 1, 2, don't rush. I don't care how high you go. What I care about is the squeeze. Imagine there's something behind your knee that you're gently pressing. That squeeze is compressing the deep veins, the ones that matter most. That's blood being pushed upward. Now slowly lower your heels back to the floor. And here is where the magic happens. Do not stop. As your heels touch down, gently shift your weight back and lift your toes. Just a little. An inch is enough. This engages the muscle on the front of your shin and stretches the calf. And that stretch allows the vein valves to snap shut. Blood goes up, valves close, blood stays up. That's the reset, that's the pump. That's your second heart turning back on. Each repetition should take about 5 seconds. Slow, controlled, intentional. Do 10 repetitions. Then rest for 10 seconds. During that rest, gently march in place. Not exercise, just movement. Then go about your day. Do this 3 times a day. Once after breakfast, once after lunch, and once, this part is crucial, right before bed. That evening set is what prevents nighttime cramps, because you're clearing pooled blood before you lie down. I've had patients tell me this single minute did more for their legs than years of walking, and that makes sense. Walking spreads effort across many muscles at low intensity. This movement concentrates effort exactly where circulation needs it. Now here's something I need to warn you about. You can do this perfectly, and still sabotage yourself if you're not careful, because there are things in your daily routine that actively shut this pump down, and most people have them sitting right in their living room. Let's talk about sitting. When you sit with your knees bent at a sharp angle for long periods, watching TV, reading, scrolling, you are physically kinking the blood vessels behind your knees. It's like folding a garden hose. Pressure builds behind the bend, flow slows to a trickle. That's why legs swell more during long sitting periods than standing. The fix isn't to never sit, it's to interrupt the kink. Every 45 minutes, stand up and do 5 dynamic rockers. 5, that's it, you're unkinking the hose. Another silent issue is sodium. Salt pulls water into your tissues. Potassium pushes it out. Most people don't have a salt problem. They have a salt to potassium imbalance. Processed foods flood the body with sodium. Whole foods provide potassium, avocados, bananas, potatoes with the skin. You don't need perfection, you need balance. And finally, socks. If your socks leave a deep red ring around your calf, they are acting like a tourniquet. You are squeezing veins shut right where blood needs to pass. Non-binding socks matter more than people realize. Compression stockings can help, but only if they fit correctly and are worn properly. Otherwise, they just create a new dam. Everything we've talked about today comes down to one idea. Your legs are not weak, they are congested, and congestion responds to flow. For the next 7 days, commit to this, 1 minute, 3 times a day. Pay attention, not just to swelling, but to how your legs feel. Lightness, warmth, ease. That's circulation returning, and once you feel it, you'll know. Now I want you to understand something important. If you start doing this movement consistently, you may notice changes faster than you expect. Some people feel it the very first day. Their feet feel warmer, their calves feel less tight, their legs feel awake. Other people notice it at night. They lie down, waiting for the familiar cramping or restless sensation, and it just doesn't show up. And then there are the changes that happen quietly. The socks stop leaving deep marks. The ankles look more defined again. Shoes feel normal at the end of the day instead of tight and punishing. Those are not coincidences. That's blood moving the way it's supposed to. But here's where I need to slow you down for a moment, because this is where people either succeed or give up too early. Your circulation did not slow down overnight. It slowed down gradually, over years. Because of sitting, because of stiff footwear, because of reduced ankle motion, because the second heart simply wasn't being asked to work. So when you turn it back on, your body sometimes needs a short adjustment period. You might feel a mild ache in the calves, a gentle warmth, a sense of fullness followed by relief. That's normal. That's circulation re-establishing itself. Pain is sharp. Pain is alarming. Pain makes you stop. What I'm describing is not pain. It's awakening. Think of it like turning water back on in a pipe that hasn't been used in a while. At first, there's noise, then flow, then clarity. Now let me address a question I hear all the time. Doctor, how is this different from just walking? Walking is excellent for many things. Balance, coordination, general cardiovascular health. But walking does not guarantee full calf pump activation. Most people walk with minimal ankle movement, especially indoors, especially in cushioned shoes. Their heel barely lifts, their toes barely flex. The valves never get that clean open and close cycle. The dynamic rocker exaggerates what walking should do, but often doesn't anymore. It's targeted, intentional, mechanical, and that's why it works so efficiently. Another common question, can I do more? Yes, but carefully. This is not a case where more is always better. 10 slow repetitions activate the pump fully. Doing 30 fast ones just adds fatigue without added benefit. If you want to increase something, increase quality, not quantity, slower rise, better squeeze, cleaner toe lift. That's where the circulation gains come from. Now let's talk about something most people don't realize is connected to leg circulation: energy. When blood pools in your legs, it's not just a local problem. That blood is low in oxygen. It's full of metabolic waste. When it finally returns to the heart and lungs, it needs to be processed. That sluggish loop affects overall energy levels. This is why people with poor leg circulation often say things like, "I feel tired for no reason. My legs wear me out. I don't have the energy I used to." It's not just age, it's inefficient blood return. When you restore flow, your entire system becomes more efficient. Many patients report clearer thinking, more stamina, less end-of-day exhaustion, because the body is no longer fighting congestion. Now, there's another piece of this puzzle we need to talk about, and this is important: hydration. Blood that is dehydrated is thicker. Thicker blood moves slower. Slower blood pools more easily. Many older adults are mildly dehydrated all the time without realizing it. Not because they don't drink anything, but because they avoid fluids to reduce bathroom trips. I understand that, but even small dehydration makes circulation harder. You don't need gallons, you need consistency, small amounts throughout the day, enough to keep blood flowing freely. Let's also talk briefly about temperature. Cold causes blood vessels to constrict, that's normal, but chronically cold feet can be a sign that circulation isn't reaching the extremities efficiently. If your feet are always cold, even in warm rooms, that's not just a comfort issue. That's circulation signaling. The dynamic rocker helps push warm, oxygenated blood downward and upward efficiently. Many people notice their feet feel warmer within days. That's a good sign. Now I want to address footwear. Shoes matter more than people realize. Rigid soles prevent proper ankle motion. Tight toe boxes restrict toe lift. Both interfere with the pump. This doesn't mean you need special shoes. It means you should spend at least part of the day barefoot or in flexible footwear, especially indoors. Let your feet move, let your ankles work. The body was designed for that. Now let's talk about nighttime cramps specifically, because this is one of the most frustrating symptoms people experience. Night cramps are not random. They happen when circulation slows even further during rest. When you lie down, muscle activity drops. If blood was already pooling during the day, it becomes even more stagnant at night. The dynamic rocker before bed clears that backlog. It's like emptying a sink before turning off the faucet. That's why timing matters. Another important point: breathing. Holding your breath during movement increases internal pressure and restricts venous return. That's why I emphasized exhaling during the heel lift. Breath supports circulation. Slow breathing calms the nervous system. A calm nervous system allows blood vessels to open. Everything works together. Now, let me tell you something I've seen again and again. People often come into my office convinced their legs are weak. They say, "I just don't have strength anymore." But when we restore circulation, strength improves. Why? Because muscles that don't get enough blood don't perform well. They fatigue early, they cramp, they ache. Flow precedes strength, always. Now I want you to imagine something. Imagine waking up and standing up without hesitation. Imagine walking through your day without constantly thinking about your legs. Imagine lying down at night and actually relaxing without waiting for discomfort to start. This is not fantasy. This is physiology working the way it was designed to, and it starts with 1 minute. Now let's address consistency. This only works if you make it part of your routine. Not something you remember once in a while. Tie it to things you already do. After breakfast, after lunch, before brushing your teeth at night. Habit beats motivation every time. One more thing I want to say, because it matters. If you've been told that your circulation problems are just genetic, or just age, or just something you have to live with, I want you to question that. Genes load the gun, lifestyle pulls the trigger. and movement, precise movement, can change the outcome. Let me be very clear about something. This is not a replacement for medical care. If you have severe pain, sudden swelling, redness, or shortness of breath, seek medical attention immediately. But for the vast majority of people dealing with heavy legs, swelling, cramps, and fatigue, this is foundational, this is mechanical, and it works. I want you to give this 7 days, not forever, just 7 days, 1 minute, 3 times a day. Observe, notice, pay attention to how your legs respond. Your body will tell you if it's working. And when you feel that change, when your legs feel lighter, warmer, calmer, I want you to remember this. Your body wasn't failing you. It was waiting for the right signal. And now you know how to send it. Now, there's something else I want to talk about, something that often goes unnoticed, but quietly determines whether circulation problems improve or slowly get worse over time. And that's how you think about movement. Many people over 60 associate movement with effort, strain, or risk. They think, if I move too much, I might hurt myself. Or, if I don't push hard, it won't do anything. Both of those beliefs can work against you. Circulation doesn't respond to force, it responds to rhythm. It responds to repetition. It responds to consistency. Your veins don't need intensity. They need cooperation. That's why this movement is slow. That's why it's controlled. That's why it works, even if your strength isn't what it used to be. In fact, it works better when you stop trying to overpower it. Let me explain something that rarely gets discussed. Your circulatory system is deeply connected to your nervous system. When you're tense, stressed, or rushing, blood vessels constrict. When you're calm, supported, and moving with intention, blood vessels dilate. This is why people often notice their legs feel worse during stressful periods of life. The body goes into hold mode. Blood is redirected. Peripheral circulation suffers. This movement, done slowly with breathing, does more than move blood. It tells your nervous system it's safe to open the valves. That message matters. Now let's talk about mornings specifically. Many people wake up with stiff, heavy legs and assume that's just how mornings are now. But overnight, circulation slows. Muscles relax. Blood settles. If the pump isn't activated early in the day, you're starting behind. That's why the first set, after breakfast, is so important. It clears what's settled overnight and sets the tone for the day. People who skip the morning set off and say, I feel okay early, but by noon my legs feel heavy. That's not coincidence, that's delayed circulation. Midday is maintenance. It prevents buildup. It keeps the system flowing. And the evening set, that's prevention. That's what protects sleep. That's what stops cramps before they start. Now, let's talk about something emotional, because it matters just as much as physiology. Many people quietly grieve the way their body used to feel. They don't say it out loud, but they remember when walking was effortless, when standing didn't require planning, when their legs didn't dominate their attention. That loss can make people withdraw, move less, sit more, which only worsens circulation. This is not a failure, it's a feedback loop. And feedback loops can be reversed. Movement creates flow. Flow reduces discomfort. Reduced discomfort invites more movement. The dynamic rocker is often the first step that restarts that loop in the right direction. I want to be very clear about something else. This is not about chasing youth. It's about restoring function. You're not trying to be 30 again. You're trying to feel capable in your own body. Those are very different goals. And the second one is absolutely achievable. Now let's address a concern I hear often. What if I have arthritis in my ankles or knees? This movement is actually protective. It doesn't require deep knee bending. It doesn't require impact. It keeps joints moving within a safe, controlled range. In fact, better circulation often reduces joint stiffness because tissues receive more oxygen and nutrients. Still, listen to your body. Smooth discomfort is okay. Sharp pain is not. Another question people ask is, What if I'm overweight? Circulation challenges don't discriminate by body size. Extra weight can increase pressure, but the pump works the same way. In fact, improving circulation often makes movement easier, which supports weight management indirectly. Again, flow comes first. Now let me tell you something important from my own clinical experience. I've seen patients with severe swelling who were told their only option was lifelong compression or medication. And while those tools can help, they don't address the root issue. The root issue is often an inactive pump. When we restore that pump, even partially, symptoms improve. Not always perfectly, but meaningfully. Enough to change quality of life. Now I want to talk about one more silent factor. Time. Circulation problems don't announce themselves loudly at first. They whisper. A little swelling here, a little heaviness there, a little cramping at night. Ignored long enough, whispers become shouts. The earlier you intervene, the easier it is to reverse, but even later, intervention helps. Because the pump doesn't disappear. It waits. Let's talk about expectations. This is not a miracle cure. It's not magic. It's mechanics. If you skip days, results fade. If you rush, results diminish. If you treat it casually, it behaves casually. But if you respect it, if you give it 60 seconds of attention, your body responds. Predictably, reliably. I want to emphasize something that often surprises people. Circulation improvements don't always show up as drama. Now, before we close, I want to leave you with a simple framework. Every day, ask yourself 3 questions. Did I activate the pump this morning? Did I prevent build-up during the day? Did I clear congestion before bed? If the answer is yes, you're doing what your body needs. And finally, I want to speak directly to you. If you felt frustrated, if you felt dismissed, if you've been told, that's just aging. Take the next 7 days seriously, not rigidly, seriously. Show up for that 1 minute. Let your legs remember what flow feels like, because once they do, they don't forget. Before we finish, I want to slow everything down one last time, because information alone doesn't change lives. Understanding doesn't change lives. Action does, but not rushed action, not perfect action, just consistent action. And I want to make sure you walk away from this video knowing exactly what to do and why it matters. Your legs are not failing you. They are responding to physics. Blood follows gravity unless something pushes it back up. For decades, your body relied on your calf muscles to do that job quietly, efficiently, without you ever thinking about it. And then life changed. Chairs got softer, shoes got stiffer, movement got smaller, days got longer, and more seated. So the pump slowed down, not because your body broke, but because it stopped being asked to work. The dynamic rocker is not an exercise in the traditional sense. It's a signal to your veins, a signal to your valves, a signal to your nervous system. It says, open, move, flow. And your body understands that language immediately. Let me walk you through it one last time. Simply, calmly, without complication. You stand with support. You lift your heels slowly and squeeze your calves. Blood moves up. You lower your heels and gently lift your toes. Valves close. Blood stays up. That's it. No strain, no pain, no exhaustion. Just mechanics working the way they were designed to. 10 slow repetitions, 3 times a day. 1 minute. That's the commitment. Not for the rest of your life, just for the next 7 days. During those 7 days, I want you to pay attention, not with judgment, but with curiosity. Notice how your legs feel in the afternoon, how your ankles look in the evening, how your body feels when you lie down at night, how your legs respond when you stand up. Don't chase a dramatic result. Let the subtle ones show up, because subtle changes are how the body heals. If this video helped you, if it made sense in a way nothing else has, I encourage you to stay connected. Subscribe. Not because you need more content, but because understanding your body gives you control, and control gives you freedom.